So determining your vascular age, that's a neat result to get on a lab test. So how old are your blood vessels? Turns out people thicken as they age. They have the lining of their blood vessels will get a little bit thicker, and the blood vessels of a 70-year-old will be thicker than somebody that's 50. So if I have a 50-year-old that comes in and wants to determine their vascular age, that is a great way to find out first if they have plaque, but also if they have premature thickening beyond what is expected for their age. So a 50-year-old could have the blood vessels of a 40-year-old, that would be great, but a 50-year-old could also have the blood vessels of a 70-year-old. And they would have a higher risk for having a stroke or heart attack. What is your lifetime risk for a heart attack or stroke? We have to answer that question. So our comprehensive cardiovascular screening test is looking for the first signs of heart disease, specifically atherosclerosis and plaque, and your risk for stroke. We have the CIMT test, which is the vascular age test. CIMT stands for carotid intima-medial thickness, and that is the lining of the blood vessel in the carotid artery on both sides that we measure. We also have two lab tests. One is the lipid particle size. Now, if you think of that total cholesterol that you get at your doctor, that's the volume of cholesterol you have in your blood. But if you actually look at the particle number, how many particles of cholesterol does it take to fill up that volume? You could have a bucket full of tennis balls, and that's the same volume, or you could have a bucket full of marbles. You would have a lot more marbles versus tennis balls. And that's kind of the way we look at particle size. How many particles do you have of cholesterol? When you have numerous particles that are small, you're increasing every particle is another chance, especially with it being small, to get into that blood vessel wall and cause atherosclerosis and plaque. Now, that plays into the thickness part of the CIMT test. When those particles get into the blood vessel wall, they're going to increase its size. That's pathological lipid pooling of the blood vessel wall. We can detect that with the CIMT test, the vascular age test. The other test we have is markers for inflammation, and if you are actually forming plaque. There are certain chemicals that are released in your blood that you can find in lab results and test for and determine if you are forming some plaque and if there's inflammation. So the two pieces to atherosclerosis and plaque, you have to have inflammation, the inciting incident that damages the blood vessel wall, and abnormal cholesterol that gets in there. So these three different ways to look at it. Do you have plaque, and do you have premature thickening by CIMT testing? And that is related to abnormal cholesterol and inflammation, the damage to the endothelium, which is the lining of the blood vessels. So that's what we're looking for with the comprehensive test. So our goal is to catch you before you have a heart attack or a stroke, because these are the first signs that we can see. They're the best signs to date that we can actually find. It's a cost-effective way. It's an efficient way to see if you have plaque, to see if you have pathological or premature thickening of the blood vessel, to see if you have inflammation in the blood, to see if you have abnormal particles of cholesterol. We will be able to determine your likelihood of having a stroke or a heart attack. And it's pretty often that we find people that had no idea. They thought they were pretty healthy and they have plaque. And there are simple lifestyle changes that they didn't know that was promoting plaque and inflammation in their body. So what we want to do is find that before it results in a stroke or a heart attack.